My name is Todd Folks, and I'm actually a member of the marketing team for Teva. I'm actually really excited to be here today and be a part of this virtual education event on HD. I'd like to sincerely thank you all for attending this presentation today. We hope that you'll enjoy the presentation, as it's going to provide background on both HD chorea along with a treatment option for the disease. Our presenter tonight is Dr. Danny Vega, who is an assistant professor of neurology at Northwestern University's Feinberg School of Medicine in Chicago, Illinois. Dr. Vega is a practicing fellowship-trained, board-certified movement disorders neurologist, also at Northwestern. Dr. Vega has expertise in the care and management of patients with a variety of movement disorders, and is director of the Northwestern's Huntington's Disease Center of Excellence and the Wilson's Disease Clinics. The talk tonight is entitled Understanding Huntington's Disease Chorea, Physician, Patient, and Care Partner Perspectives. This should be a very informative discussion that we hope you'll enjoy. Also joining this presentation are two members of the HD community. We have Nathan and Heather Wilmoth. Nathan and his wife, Heather, are from Mississippi. Nathan was diagnosed with Huntington's disease in 2015, and Heather has been by his side as his care partner ever since. So without further ado, I'll hand this over to you, Dr. Vega.
Thank you so much. It's a pleasure to be here. I really want to thank Teva for organizing this. And as you heard, I'm a physician, neurologist, and I spend a lot of my time taking care of patients and families with Huntington's disease. I think what makes this talk today so special is that I get to, part of the talk, bring in a person and his care partner living with Huntington's disease who have to deal with this condition all day, every day, and who are real experts. So the topic today is understanding Huntington's disease chorea. If you don't know much about chorea or why this is an important topic, you're going to learn about that today. It's entitled Physician, Patient, and Care Partner Perspectives, because you're going to, as I mentioned, get to hear from Heather and Nathan in a little bit about their experience dealing with chorea and the impact that chorea has had, and also on how the impact of treating chorea has had on them. So first of all, this is a promotional program that was developed by Teva, and I'm a paid speaker presenting on behalf of Teva, receiving compensation for giving this presentation. So today's agenda, I'm going to start by describing chorea and most importantly, the impact of chorea, why it's important that we are even talking about chorea and Huntington's disease. And that's where I'm going to then invite Heather and Nathan to talk about their personal experience living with chorea and managing chorea. We'll then talk about a management option for chorea, and we'll talk about some questions. And you can insert your own questions in the chat at any time, and then most likely I'll get to the questions at the end of the talk, but please feel free to put them in the chat at any point. So starting with Huntington's chorea, Huntington's disease, in terms of the symptoms that it causes, we typically think about three major areas of symptoms: cognitive, motor, and emotional or behavioral symptoms. And this different degrees of problems in these different areas affect people with Huntington's in a progressive way over time. And so this is a neurodegenerative disease, meaning there's gradual progression along the spectrum of these different problems. And the brain controls these functions, and in Huntington's disease, there's an abnormal mutation that leads to neurons or nerve cells in the brain to malfunction. And the consequence is dementia over time, and to various degrees, different mood symptoms, and then motor symptoms. And today, we don't have enough time to cover the cognitive or emotional behavioral symptoms, which are important topics in themselves, but we're going to spend today talking about the motor symptom, and particularly the most common and important motor symptom that we see day to day with Huntington's, which is chorea. Chorea is the most prominent motor symptom, and it can appear at any point in the disease course, but often we see it early on in the course of the disease. And it's this excessive movement. It's an involuntary, irregular, jerky, excessive, hyperkinetic movement that can occur in any part of the body. We can see it in the face, in the mouth, We can see it in the trunk and the shoulders. We can see it in the arms or the legs. And it sort of looks like a fidgeting or an excessive irregular movement that a person typically can't control, and it's involuntary. And so nearly 90% of people with Huntington's disease develop chorea. So what does chorea look like? Chorea comes from the Greek word for dance. And so chorea movements sort of look like dancing movements, jerking or irregular movements, fidgety movements. And they can be mild, they can be severe. And they can result in different parts of the body moving when you don't want them to move, which can result in problems with functioning. They can be worse when someone is stressed or fatigued, so they can vary from hour to hour or day to day, or from, depending on what you're doing, from one task to another. And as they become more severe, they start to impact day-to-day life more, as they can lead to problems with motor tasks. So you can imagine if you're fidgeting or moving excessively, it could be hard to control balance, or feed yourself, or dress yourself, or speak clearly, as these irregular movements are occurring out of your control. So I'm going to show you an example of what that looks like. I'm gonna show you the example that we're calling here moderate. Oh, let me try that again. There we go. Hopefully that video is playing for you. And so you'll see different examples here. First, in the face here, this gentleman's tongue is moving irregularly. In this case, I see frequent movements of the shoulders or of the mouth, almost looking like he's smiling intermittently. Here I'm seeing the trunk moving, the neck is moving, the hands are fidgeting. It causes these muscles to activate when you're not trying to activate them. You can see here the feet are moving up and down, the body, the torso is moving back and forth in different directions, and it's irregular and it's just a little fidgety. I'm going to show you another example that's a little bit more severe. And this is calling this severe, it's subjective. Just looking at this though, there's a lot of movement happening when it's not supposed to be happening. And the question we're going to ask next is, why is this a problem? It's not necessarily painful, and we'll hear from a person living with this and we can ask that question. It's typically not painful. But it can be distressing for various reasons. You can see these movements of the shoulders here happening irregularly. The arm is moving irregularly. Again, these are movements happening when they're not supposed to be happening. So what's causing this? Well, Huntington's disease affects most of the brain, but the part that's relevant to these movements is the deep part of the brain. We call it the basal ganglia, and it's shown in blue here. And this is the part of the brain that controls movement. And in Huntington's disease, cells that are relevant to signaling of a chemical called dopamine are deteriorating quicker than they're supposed to. And so dopamine signaling goes a little bit haywire. And dopamine is a chemical that facilitates normal, regular movement. And so when you lose cells in this part of the brain, you don't regulate that signaling normally. And so that the dopamine signaling goes a little crazy and you get excessive movements. And so this is the area that we know is responsible. And the chemical, as I mentioned, is dopamine, which is sort of signaling too aggressively through this part of the brain. And a normal balance of dopamine is needed to control normal movement. This will be relevant when we talk about treatment later on and how we affect dopamine in order to manage this. So in terms of the impact, why are we talking about this? Why is this a problem? And so one of the main things is that it affects day-to-day function and activity. And so this is us looking at surveys of self-care activities in people with Huntington's disease. And in green bars is the people with Huntington's disease who have chorea, and in the blue are the people with Huntington's who don't have chorea. And you can see that the green bars, those who have chorea, have more trouble or need more assistance with these day-to-day tasks, handling finances, traveling, managing daily activities, getting dressed, shopping, eating. The green bar is longer in all of these situations, showing that those who have chorea are needing more assistance with all of these basic day-to-day care activities compared to people without chorea. So there's some relationship between having chorea and needing more help with these different day-to-day tasks. And so let's look at some examples of how chorea might affect that. And to me, the one that I worry about the most, one of the ones I worry about the most is walking. So I'm going to show you that one first. You can see this gentleman has chorea affecting his trunk, his hands, his legs, and it's throwing his center of gravity off. And so he's thrown off balance a little bit. And he can still walk independently, but you can see how his chorea, his movements, because it shifts him off balance, really makes his walking more unsteady. And I raise this for a couple of reasons. One is it's a reason that we want to pay attention to the chorea and think about treating the chorea in someone like that, because we want to make sure he doesn't have falls. And if we can reduce his risk of falls, we can improve his quality of life. And if we can improve his balance, we may be able to improve his quality of life. But also because it's important to realize that we may need to think about the actions that someone is impacted with more than just the chorea itself. In this gentleman, I might not ask him, how bad is your chorea, or how much are you bothered by your chorea? I might ask him, how much are you bothered by your balance problems? How much are you stumbling or having walking problems? And then it's my job as the physician to determine that the problems he's having walking or with balance are because of his chorea. And then that may be a reason that he may want it treated, is because he's focused on his balance or his walking, and not so much the word chorea being what's important to him. I'm going to show you another example of eating and drinking. This is, you can imagine these movements of, first of all, the mouth and jaw movements that are irregular can cause some trouble with the chewing and swallowing and coordinating those movements. But then also just getting the spoon from the bowl to the mouth and coordinating that can be thrown off by the irregular movements. And so this can lead to difficulty chewing, swallowing, eating, and this can be embarrassing for people as well. And so one thing that we're looking at tasks, but one point is also how much socially this affects people, or how much assistance they end up needing because of this. As a result of the chorea, does someone need to be helped to be fed, for instance, to get the food into their mouth successfully? So I mentioned that it has an impact, it can have an impact on day-to-day function, but it's interesting that actually sometimes it's the family that mentions the chorea, or the doctor that notices the chorea, and sometimes not the person living with it that brings it up. So there can be a lack of awareness or a lack of insight into one's own symptoms in Huntington's disease. This is part of the cognitive changes that occur with the disease, is that there can be a lack of awareness. So the person living with these movements isn't always that aware of the movements, and it may be the observer who notices the movements. However, that person still may be aware of how it's impacting them. So they may not be aware that they have chorea, but they may be aware that they're bumping into things or stumbling or having trouble eating. And so it's important to make the connection for them, if they're not noticing it, between the movements and the function that is impacted. Sometimes people do refuse to be treated for it, or don't want to be treated for it, because they don't realize or recognize that it's a problem. And it's important to make them aware of not just that they have movements, but again, what the impact of those movements is on their day-to-day function. Because that can be sometimes a tricky area to navigate, is if someone doesn't recognize there's a problem in the first place. You can see this is from a survey of asking patients with Huntington's and then asking their care partners what symptoms were most impacting them. And in blue is the care partners, and in green is the patients. And if you look at chorea all the way on the right, it was 30% of care partners said chorea was the most bothersome or impacting symptom of their Huntington's, whereas it was 17% of patients who said it was the most bothersome. So it was the care partner observing that said this was the most bothersome symptom in that percentage of people. So you want to have a conversation with the patient, the doctor, and the care partner about how is chorea affecting day-to-day activities. What can we do to modify the impact of the chorea? Can we use utensils or that might be easier to use? Can we make the home or work area modified in a way that leads to less balance problems or bumping into things less? Does it interfere with tasks that the care partner has to then help with? How much balance may be affected by the movements? Is it affecting you socially? Is it because of the Chorea that you don't want to interact with people or go to activities or do things? And is it impacting your, are you worried that people are noticing it? Is it leading to stigma for you or for your family in terms of being concerned that people are observing this? So think about those things and not just how big is the movement or how frequent is the movement, but also just kind of how it's affecting these different aspects of life. So with that in mind, let's make this a little bit more real. And I'm going to introduce Heather and Nathan. I'm going to, oh, they've just turned their cameras on. Thank you. So I'm going to let Heather and Nathan introduce themselves, actually, but I really want to thank them for joining us today and giving us some real life insight into living with Huntington's disease.
Hey. Thank you. Thank you for having us. Obviously, I'm Heather, and this is Nathan. Nathan was diagnosed in April of 2016 with Huntington's. And I do need to mention that we're sharing our personal experience on behalf of Teva. We have received compensation from Teva for sharing our story, and the information that we're sharing is based on our own personal experience and consistent with the medication guide for Austedo.
Thank you. Thank you again for joining us. And so we're just going to have a little conversation about Chorea here. And, you know, we've just kind of set the stage for what Chorea is and why it's important. But can you both share with us, you know, when Chorea first started to affect you, when it was first noticed or who noticed it, and kind of in what circumstance was it noticed?
When I was at work, I started shaking.
He calls Chorea shaking. So when Nathan was a diesel mechanic, and his former boss noticed that he seemed to be intoxicated looking, and Nathan was dropping expensive, high dollar 18-wheeler parts. And so he noticed, his former boss noticed actually first. And then he actually ended up, because of the Chorea, looking back, we can see this. At the time, we did not. He actually ended up losing that job because of his Chorea.
I'm sorry to hear that. Can you, so it was affecting your functioning at work. Presumably that means that it was affecting your hands. Can you, like, what did it feel like to have these movements? You called them shaking. Tell us about sort of where you felt it or how it affected your use of your hands.
My arms and my
Your arms and your hands, how did that feel? He commented on occasion how he felt like he had no control over his body, and over what he was able to pick up. And even at home, he would drop things. And, you know, at the time, looking back, we can see it was Huntington's, but at the time we didn't think that. We just, you know, played it off as butterfingers and things like that. But it really affected, and what we noticed first was actually in his hands, because when you're a mechanic, that is the most valuable thing you have, are your hands.
Sorry.
And so, yeah, it's not uncommon for Chorea to be the presenting reason that someone comes to get diagnosed or see the neurologist in the first place. You know, so is this what led you to see the doctor, and how did you get how did things change for you once you were diagnosed then?
Our catalyst was I was actually pregnant with our son at the time he lost this job. And my aunt was telling us, you know, Nathan has a daughter from his first marriage, and we have a son together. And right after our son was born, Nathan was still unemployed, but about to start a new job. And my aunt was encouraging us to get life insurance. And in that process, Nathan was, he had to lose 10 pounds. to get the cheap rate, and then he had to get the more expensive rate because of his mom's Huntington's. And so that led Nathan to one day, he just goes, you know, I'm tired of this. You okay?
Excuse me.
I'm tired of this hanging over my head. If I have Huntington's, we'll deal with it. But if I don't, we're getting that cheap rate. Well, unfortunately for us, he ended up having Huntington's.
So how did you feel when you were given that diagnosis early on?
It was hard.
Yeah.
Hey,
I don't know if he could be understood. He said it was hard. He's not going to lie.
Yeah. Did something change at some point in terms of how you dealt with that and came to accept that?
I got depressed.
With any kind of diagnosis like that, there's going to be depression, and it took us a little while to process it. You know, we were really devastated, and then we ended up we were led to a doctor here in Mississippi who specialized in Huntington's, who knew that we were interested in doing research. So we ended up going to another state for research. And that particular doctor is the one that really changed our perspective. We really felt like we were waiting for the other shoe to drop. We were waiting, you know, we just, you know, felt like Nathan had a death sentence over his head and had really lost all hope.
So tell us about what changed then when you started. So it sounds like you started to see sort of more of an expert in Huntington's disease, or someone with more focus on Huntington's. And at that point, sort of what changed in your care?
Well, for one thing, we met this extremely positive doctor that specializes in Huntington's, and we began learning more and changing our outlook. And then what really helped was that this particular doctor had been a testing site for this new medication, and the clinical trial was over for it, but he had a list of patients that he wanted on the medication, and he added Nathan to it, and it really helped with the chorea, or what Nathan calls shaking. And
I ain't that bad.
But anyhow, it really helped, and that kind of helped change the perspective in a way too, because Nathan felt more normal again.
And so the medication you're talking about is Austedo.
Correct.
So when you started Austedo, you saw a change in your chorea, or can you tell us about sort of what you noticed as the positives of that?
I got better, big time.
He was able to hold tools and such.
Yeah.
He had started another job at this point where he was a diesel mechanic there, and he was able to actually work another 6 months before he ended up having to come home. And so that really helped.
My cognitive got.
But anyhow, that just being able to have that independence back to a degree, or for lack of a better way of putting it, really helped.
So there were things that you were able to do more easily with your hands. Is that correct?
Got that right.
Before starting treatment with Austedo, did your doctor warn you about anything, about any side effects?
Yeah.
Yeah, he warned us that depression was a side effect, but thankfully, you know, we've only had a great experience with Austedo. We've had a very positive experience.
Mm-hmm. Well, it's great to hear. So can you, just to kind of close this discussion a little bit, tell us sort of how you feel you have, what your role has been, Heather, as kind of the care partner here, how you've supported Nathan through this process, and sort of what you've noticed that's come out of this.
Well, what's come out of it, honestly, is that with the HD as a whole, is we've actually gotten closer as our relationship has gotten closer. I have noticed that, you know, some of the independence is going, but you know, it in its place is just, I can't explain. I'm like at a loss for words, and this is the wrong time to be at a loss for words. We just, you know, day by day, we can tell when Nathan's tired, and his Chorea will be a bit more pronounced, like you were saying earlier. But for the most part, I mean, he's able to sit here, sit still. He can still feed himself for the most part, and just, you know, day by day, and just thankful for that.
I'm glad to hear that. Is there anything else you want to share, either of you want to share with today's audience regarding your experience living with Huntington's disease or caring for someone with Huntington's disease?
Is there anything you want to share?
I'm glad about that medicine.
He's glad about the medicine because it really does help him considerably. And as far as me, just find a doctor that specializes in Huntington's. If you're newly diagnosed or considering being tested, that's a very, very important, is to find that doctor that knows what's going on.
Well, thank you so much for sharing your insights. And with that, I'm going to continue and talk about the management of Chorea now, and then we'll take some questions at the end. Thank you again, both of you. I think it's really important to just hear from again, I consider myself an expert in managing Huntington's disease, but people living with it day to day really have so much insight and important information to share with us. We're going to talk about Huntington's Chorea now, and kind of planning for it, and deciding on management. And so one of the questions is sort of when to talk about managing it. And it's something that really comes to the clinic at any point. I can see people with Chorea who come in with really mild Chorea, and people who come in with more advanced or more bothersome Chorea. And one of the things that is really important is we do measure the severity of it in the clinic in terms of rating the severity, how much of the body is involved, and how bad the movements look. But it is really important to talk about activities. And one thing you can do is list activities that you want to be able to do better on your own, that you're having trouble with from a motor standpoint, that you're asking your family members to help with, and sort of trying to identify if Chorea is impacting those activities. And then you want to consider making changes to your living environment that can make it safer, whether that's using things like occupational and physical therapy or equipment or other things that can make day-to-day life easier. But ultimately, this should be also a discussion with your neurologist. And you want to use the activities and your limitations and your goals to decide on whether it's worth starting treatment for those movements. And you want to involve ideally your loved one or your care partner or your family member in this discussion, because they may be noticing things that you don't notice as the person living with Huntington's disease. So you can keep track of movements. You can keep track of sort of what activities are impacted. Use the words that are useful to you. And you heard Nathan talk about shaking as the way he described it. Describe the movements as clearly as you can possibly describe it, and then your doctor can try and figure out if it's Chorea or something else. Ask someone to join you for the appointment so that they can give their insight into what they're seeing as well. And then think about what activities are important, not just whether you have the movements or not, but whether you're dropping things more, stumbling, spilling, having trouble doing fine motor things. Those might be areas where treating Chorea might be worth pursuing if these are problematic. So things you might want to talk to your doctor about, why do you have Chorea? Will it go away? Can it get worse? How do we assess it? How do we track it? These are things that you can talk to your doctor about in the visits. you want to ask about next steps. Once you've talked about the problem, what are the next steps in dealing with the problem? How do we manage it? Is there a treatment for it? And how do we go about that? So we're going to talk now about Austedo, or deutetrabenazine. And so the information I'm going to be presenting is consistent with the FDA-approved indication for this medication that is on the label for the medication and can be found in detail on the website, austedo.com. Austedo is a prescription medication that is indicated for the treatment of these involuntary movements, or chorea, associated with Huntington's disease. It doesn't treat the disease, it doesn't treat Huntington's disease, it treats the movements, and it doesn't treat other symptoms of Huntington's disease. So it's not a cure, it treats the symptoms, and it's specifically meant to treat the motor symptoms, the involuntary movements. It's not meant to treat the cognitive problems or the emotional problems. And it's not known if it's safe or effective in children, because it was only studied in adults. So an important, as we talk about benefits, we also want to talk about, to be balanced, we want to mention potential side effects. And one of the things you'll see on the label for Austedo is that there's a warning, as Nathan was warned about by his doctor, that can cause side effects in people with Huntington's disease, like depression or suicidal thoughts or suicidal actions. And so you don't want to start Austedo if someone has poorly controlled or uncontrolled depression or active suicidal thinking. This is a discussion that needs to be had with the neurologist, and the neurologist and the psychiatrist can determine if this is a safe medication to use. And this is something that they would be able to determine if they, if it's a doctor who knows you well. Do not take Austedo if you have active suicidal thinking. This is something, again, to mention to your doctor before starting it. If you have liver disease, or if you're on certain medications, in a class of medications known as monoamine oxidase inhibitors, which are not often used in Huntington's disease, but are mentioned here just in case, or a medication called risperidone, which is also not a medication you typically see used in Huntington's, but just mentioning it here again. Also importantly, it should not be taken along with other medications that are called VMAT inhibitors, and examples are tetrabenazine and valbenazine. So should not, if someone's on tetrabenazine or valbenazine, they should not also take Austedo. So there was a study that led to the approval of this medication, and it showed that Austedo was effective for treating, for reducing chorea in people with Huntington's disease. And the way it works, if you remember, I mentioned that the problem with excessive movement in Huntington's is excessive dopamine signaling. It's a chemical in the brain that is signaling too excessively. And Austedo works by inhibiting the release of dopamine. So if it doesn't release as much dopamine, then you don't get as much of that excessive signaling, so it doesn't lead to as much movement. And so that's how it's thought to reduce these movements, by reducing the release of the dopamine. And so what they did was they took, in this study, they took 90 people with chorea and Huntington's disease, and they studied them for 12 weeks. They split them randomly. 45 of them got Austedo and 45 of them got a placebo, a sugar pill, an inactive pill. And they measured the improvement in the chorea over that 12-week period. And so we can rate the severity of the movements in the different parts of the body. And they looked at it at the beginning, and they looked at it over the 12 weeks. And they compared the group who was getting the medication to the group getting the inactive, or placebo. And we rate the chorea in different body regions shown here. We rate it in the face, in the mouth, in the arms, in the torso or trunk, in the legs. And the total, if someone doesn't have any chorea, they would get a 0. And the most they could get here is a 28, because each of the regions rated is from 0 to 4. And there are 7 regions of the body that are rated. So the worst they could get is a 28. And here on this score, what they saw was this score improved in people who were getting Austedo more than it improved in the people who were on the placebo. So after 12 weeks, they saw more than 2 times improvement in that severity of the movements compared to placebo. In the Austedo group, they improved by 4.4 points on that scale, and on the placebo group, only 1.9 points, and that was significant. And some people improved a little, and some people improved a lot, and you can see that 33% of people, about a third of people, improved in the Austedo group, improved by at least 6 points. So 6 points or more, which is a fairly big improvement in about a third of people. They also asked people to just say whether they felt like they were improved or much improved. And they asked the doctors to also rate whether they thought the patients were improved or very much improved or much improved. And you can see that the patients, 51% of people who got Austedo compared to only 20 on the placebo pill felt that they were much improved or very much improved. And with the doctors, about 42% thought the people on Austedo were much improved or very much improved compared to only 13% who got the placebo. So it was basically saying that the doctors and the patients were noticing some improvement compared to when they were just getting placebo. In terms of side effects, in the study, the most common side effects were these four shown here: sleepiness, dry mouth, diarrhea, and tiredness. Of the people who got these side effects, 2% actually wanted to stop the medication and leave the study because of these side effects. So the majority were able to tolerate these side effects and stayed in the study. They also looked at how people did over a longer period of time. Now, once that first part of the study was over, they let people stay on the medication and they studied them for 3 years. And 119 people with chorea who were getting Austedo were followed for 3 years. And what they saw was that the scores continued to be improved over that period of time. So they saw sustained benefits over a 3-year period. Some people have been, especially before this medication became available, may have been using a medicine called tetrabenazine. And there's some similarity in the molecule tetrabenazine to this drug, Austedo, which is deutetrabenazine. And so if someone's on tetrabenazine and they wish, or their doctor wishes to switch them to Austedo, there is a way to easily convert that or do that overnight. Basically, by switching it to half the number of milligrams of Austedo, and it can be an overnight switch that the doctor can do pretty easily. And so the doses of Austedo can be tailored to the individual needs of the person. Some people may need more, some people may need less. It comes in 3 different types of pills: a 6 milligram pill, a 9 milligram pill, and a 12 milligram pill. It's taken twice a day, and it starts at 6 milligrams twice a day, and it can be increased 1 week at a time until we get to the dose that is effective for reducing the chorea. And so your doctor will give you a plan for increasing this 1 week at a time. And luckily, the company makes kits that can help you just get 1 week of each dose at a time. So you can take, like in a blister pack, you can get each week's worth of doses so that it's easy to figure out what to take week after week after week as you're increasing it until we find the right dose for you. So it's often some combination of these 6, 9, and 12 milligram pills that we use to make the dose that you need. And it's taken by mouth. The pills are taken whole, they're not cut or crushed, and they're taken with food. So I usually tell my patients to take it with breakfast and with dinner. In terms of getting access to the medication, this is something that the representatives from Teva, and then also your doctors and nurses, can help give you access to. But there's ways of making sure that people have access if it's expensive for them. There's financial support programs, and there's support for the clinic and the nurse to help get this in your hands. And there's ways to make sure that close to 90% of patients who are on it pay $10 or less per month for their prescription. There's this program called Shared Solutions that your doctor and the team can tell you more about if this is an appropriate medication for you. Some additional safety points just to bring up. This is something for your doctors and medical team to pay attention to, which is the potential to prolong certain parts of your heart rate. This is something that the doctor can decide if this needs to be monitored for or not. There's a rare condition called neuroleptic malignant syndrome, which can be associated with stiff muscles and high fever and confusion that the doctor would have to be alerted to managing. If there's any restlessness that can result from taking certain medications like Austedo. And then because Austedo is reducing the release of dopamine, it's important to monitor for what we call Parkinsonism. And this is like a tremor, slowness, stiffness, shuffling of the walking that can result from depleting the dopamine too much. So essentially being too aggressive with the medication. This is something your doctor can look out for. Sleepiness was the most common side effect seen with Austedo, and so you want to make sure you know how it affects you before you do anything that could be dangerous if you fall asleep. The most common side effect was sleepiness, then diarrhea, then tiredness, and dry mouth. In a different disease that this drug is used for, a study of a population of disease called tardive dyskinesia, where this drug is used, the most common side effect was sore throat, nasopharyngitis, or inflammation of the nose and throat, and then insomnia, problems with falling asleep. So kind of the opposite. And then any additional side effects should be reported to your doctor and to the FDA. This is sort of a summary slide, and then I'll be happy to take some questions with the time that's left. But with Austedo, there's been shown to be significant reduction in Huntington's disease chorea. We measure that using the chorea score, and it's been compared to placebo and was shown to significantly reduce it compared to the placebo. Long-term use, as they followed people for 3 years, showed a lasting effect of the medication on the chorea. And patients and doctors both reported that they felt that there was improvement compared to placebo. The most common side effect of Austedo that was seen in the studies was sleepiness, diarrhea, tiredness, and dry mouth. So with that, I'm happy to take questions that you can put into the chat. And actually, some people had submitted questions ahead of time. So I can start with some of those while people go ahead and feel free to type other questions in the chat as I look through some of these. So I'm just reading some of the questions that were submitted ahead of time. The first question is an important one, is someone saying that their girlfriend has chorea, but doesn't want to take medication for it. How do you address this? Because it is affecting her function. And so this is sort of what we got at the beginning, and this is common. I see this all the time, and this is the lack of awareness is part of it. The person living with the movements isn't always aware that they're moving, even if the movements are obvious to the observer. Or they may be aware and they don't know that it's impacting them or care that it's impacting them. And so I would start by just not focusing so much on the movements, but on the function, on the day-to-day tasks that you think are affected by the movements. And pointing out, are you bothered by the fact that you're dropping things or spilling? And do we think that maybe there's a way of helping with that? Let's talk about, are you noticing you're stumbling and tripping? Would you like that to be addressed? Can we talk about how to address that? And that may be the best way to kind of start that discussion with the neurologist and focus on the function and the activities that we might want to target. Now, the studies that were done were really focused on improving the chorea, and they didn't look specifically at the functions, but we can, in the clinic, we may want to talk about it that way. When do people usually start taking medication for chorea? Well, so for this, again, it's not really about the severity purely. I have people who I treat for chorea who have mild, what I would call mild chorea, and I have people who I treat who have more severe chorea. And I think the time to treat it is when it's bothersome. But bothersome could be different to different people. For the mild people, it might not be affecting their function, but it might be bothersome to them just to know that they have it, socially, or maybe they don't just like knowing that they're showing symptoms. And trying to improve that for them can improve their quality of life if they're bothered socially, if they're avoiding going out, if they're having people notice it. And so that might be someone where it is worth treating. And then on the other hand, it's, when it's clearly more severe and it's obviously affecting function, you definitely want to treat it to improve that function. So it really is a discussion to have with the doctor. One question is, will chorea go away in the later stages of Huntington's disease? This is a really important question. Actually, it may in many cases. So chorea tends to be worse early and middle stages of the disease. And then over time, there's this phenomenon as people get more advanced where the chorea can fizzle out and they can actually stop having as much movement and actually can become slower and stiffer and may not need treatment at that point. And so this may be something where they may be treated early on and eventually maybe the medication is stopped later in the disease when they don't need it anymore. It's not true for everybody. Some people, even in later stages, have more severe chorea, but I find that a lot of people as they get older can have less chorea just naturally over time. I have a question here about, will Austedo help with swallowing and making it easier to communicate? Here, the answer is not that clear. It may, but this is a more complicated problem. So speech and swallowing are in part motor, and in which case, if there's a lot of abnormal movements of the tongue and mouth, then yes, treating that can help with some of the swallowing and speech. But some speech and swallowing problems are also cognitive. And so it's possible that even with treating chorea, there could be ongoing problems with swallowing and communication, because some of that could be more related to the cognitive changes and not just the motor changes. And then what type of doctor should I see if I think chorea is starting? And certainly I'm biased. I definitely think you need to see a neurologist to feel like someone has comfort and expertise, first identifying that it is chorea, and then in knowing enough about the medications to treat it. I think you're likely gonna benefit most from seeing someone who has expertise in Huntington's disease. And I know that that's not always possible depending on where you live, but there are a lot of Huntington's disease centers where people have more experience in Huntington's disease. I would say a movement disorder specialist at minimum would be the best way to start. If you don't have a Huntington's disease center accessible to you, then at least trying to find a movement disorders neurologist who can specialize in movement problems. So those are all the questions we had submitted ahead of time. Happy though to take any additional questions. And also, Heather and Nathan are still here if you have questions for them as well. And if there are no questions, of course, I just want to say I really appreciate everyone's attention and your time in joining us today. I think this is a really important topic. I really want to thank Heather and Nathan for sharing your personal story, which obviously is not an easy thing to do, but gives us a lot of insight into dealing with this. Well, thank you all for your attention. I hope you all have a good night.